During the launch of Strategic Plan of Program for Accessible Health Communication and Education, PACE, the Director General at the Ministry of Health commended the public for good fight against COVID-19, citing Soroti, Karamoja and Kabaale as problematic districts with spike in transmission.
Kampala is doing very well. Soroti is a problem, a little problems in Karamoja and somewhere down in Kabaale. But otherwise, if we could keep serious, I think we could save ourselves from a third wave. The total cases to date are 126,435, with a cumulative deaths of 3,110, which are many. Of course, 3,000 cases are very many.
The strategic plan launch was graced by the State Minister, General Duties at the Ministry of Health, Hanifa Kawoya, Director General at the Ministry of Health, PACE staff and implementing partners. PACE implements interventions aligned to the Ministry of Health priorities and aims at achieving universal health coverage for Ugandans through consumer-powered healthcare approaches that empower communities.
Supplement the Ministry of Health's service delivery to reach down to the communities. They have their other structures, for example, through the VHTs. These VHTs who are now heavily trained in areas of service delivery. And they reach in the communities to ensure that they find out that the outbreak diseases, they don't stop there, they go further to even give services, health services.
We are glad that we have been part of this journey with PACE and commit to providing the leadership to ensure that we achieve the strategic vision of the ministry and the vision of PACE, and that all of us contribute to improving quality health services for especially our rural poor.
The Executive Director of PACE notes that the next 5 years they will focus in some of the areas like digital solutions to convey health information to households.
The studies already saw by Uganda Bureau of Statistics that 75% of households own at least a phone. So we are working on that to reach the homes with digital solutions, using the phones as a measure of delivering services, especially prevention services. And our fourth major area is also strengthening institutional capacity and networks.
Zahara Abigaba, UBC News.